I'd like to thank you all for being here today. Indian River County has a history of coming together in difficult times to support each other and our community. I would ask all members of our community to practice kindness and compassion in this difficult time. People are stressed and concerned, and it is imperative that we act with prudence and responsibility to ensure that we don't spread panic through our community. Indian River County has been preparing for this along with our local, state, and federal partners, and I want to assure everyone that we will get through this together. We are prepared and resources are mobilized and will continue to be put in place to help all members of our community work through the impacts of this pandemic. We are very lucky to have great community partners in our nonprofit agencies who have set up funds for those impacted and are working to connect citizens with vital resources. Today you will hear from the Department of Health, county and state officials who will update us on what is being done in Indian River County. Please be assured that the health of our residents and members of our community are our foremost concern, and with everyone's help, we will get through this together. With that, I will turn it over to the Department of Health.
Thank you so much, Susan. Good afternoon. Well, it is afternoon. My name is Miranda Hawker, and I'm the health officer for Indian River County. The Florida Department of Health has been working closely with the CDC to monitor the COVID-19 virus. The health department has been working closely with our local partners for several weeks to ensure the most current CDC guidance is disseminated to our local community. The department is actively involved through enhanced surveillance for respiratory illnesses that may be COVID-19. Epidemiology staff are following up on any suspected cases that meet criteria to arrange for testing and monitor contacts of any confirmed cases. Last night, the Florida Department of Health confirmed one case of COVID-19 in a 77-year-old female in Indian River County. This is not a travel-related case and is under investigation. Today at 11 o'clock a.m., the department confirmed a second COVID-19 case in a 69-year-old male that was travel-related and has a history of international travel. The cases have been self-isolating at home and were detected through testing at the health department and Cleveland Clinic and Indian River Hospital. The health department has been in contact with patients who are recovering. As we've said before, everyone has a responsibility to prevent the spread of this virus. Symptoms can appear 2 to 14 days after exposure. Most people, about 80%, will experience mild to moderate symptoms, which include fever, cough, and shortness of breath. We are especially concerned about those at greater risk for serious illness. Older people and adults who have serious underlying medical conditions seem to be at higher risk for more serious COVID-19 illness. This includes people 65 years of age or older, people who live in a nursing home or long-term care facility, people who are immunocompromised, people of any age with the following underlying medical conditions: heart disease, diabetes, and lung disease. I can tell you that we have worked with our partners to provide extensive outreach and education to our area's assisted living facilities and nursing homes to ensure that our most vulnerable citizens are protected. There is currently no vaccine or specific treatment to prevent COVID-19. The best way to prevent infection is to avoid being exposed to the virus. Avoid touching your eyes, nose, and mouth. Avoid close contact with people who are sick. Stay home when you are sick. Cover your mouth when you cough or sneeze. Clean frequently touched surfaces. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing or sneezing, going to the bathroom, and before eating or preparing food. If soap and water is not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Many of you have heard the term social distancing, and that's a new term to many people. It's not so much of a new term to public health, but it's very important when we're looking at minimizing the spread of COVID-19. Avoid mass gatherings in groups of more than 10 people. Stay home and minimize your interactions with others. If you are at an increased risk because of age or serious underlying medical condition, it is especially important that you take action to reduce your risk and limit your interactions with others. We encourage our Indian River County residents to keep using prevention measures and monitor yourselves for symptoms of COVID-19. And I know I've said this before, if you become sick, stay home. If you have a fever and symptoms of respiratory illness, such as fever, cough, and shortness of breath, or had close contact with someone showing these symptoms, or recently traveled from a CDC-advised area, call ahead to your healthcare provider and the health department. Your healthcare provider will evaluate you and rule out other illnesses and may recommend testing. At this time, testing by DOH in Union is limited due to collection of specimen kits. A reliable level collection kits is planned. Clinic in Union Hospital will have additional information on testing as part of your briefing. The Department of Health has established a local call center, and that number is 772-794-7411, and that line is active Monday through Friday, 8 a.m. to 5 p.m. The Emergency Operations Center has opened their Emergency Information Center to answer COVID-19 questions. That number is 772-226-4000. The Emergency Information Center will be open from 8 a.m. to 5 p.m. beginning today through Saturday, and hours will be adjusted as needed. The Florida Department of Health call center at the state level is in place 24/7 to answer questions. That phone number is 1-866-779-6121. Residents can also email 24/7 at COVID-19@flhealth.gov. The dedicated website is www.flhealth.gov. And that information is updated at 11 and 6 p.m. with the latest information. And it also shows you a dashboard featuring a map of the state of Florida with case counts in each county. At this point, I'd like to turn things over to Cleveland Clinic, Indian River Hospital.
Thank you, Miranda. My name is Greg Rosenkrantz, and I'm the president of Cleveland Clinic, Indian River Hospital. Thank you for being here today. Given the contagious nature of the coronavirus, we fully anticipated that there would be a positive case in Indian River County at some point. We are at that point. We've been preparing for this for more than 2 months as Cleveland Clinic, Indian River Hospital. Physicians and leaders have been holding regular multidisciplinary planning meetings. As a healthcare provider, our focus is to care for our patients, caregivers, and organization as part of the greater community that we serve. We've been working closely with our public health partners at the Florida Department of Health at both the local and state levels. We've been focusing on what we can control, screening patients, training and educating our caregivers, making sure our hospital processes are in place, and educating the public. None of that will change now that this is the first patient with COVID-19 has been confirmed in Indian River County Department of Health. We will continue to follow the processes and protocols that we have in place, which are designed for the safety of our patients, visitors, caregivers, and our community. We encourage individuals who've been tested to continue to remain in self-quarantine until they receive their results. We encourage individuals to continue social distancing as much as possible. We encourage individuals who are concerned they may have signs and symptoms of COVID-19 to use a virtual visit platform such as Cleveland Clinic's Express Care Online. Patients may also call our nurse triage line between 9 a.m. and 5 p.m. That number is 772-226-4846. I'm going to turn it over to Dr. David Peter, who is our Chief Medical Officer at Cleveland Clinic, Indian River Hospital, for some additional comments.
Good afternoon. I would like to talk to you a little bit about our drive-through testing location at Cleveland Clinic, Indian River Hospital. The patients can call the nurse triage line between 9 a.m. and 5 p.m. That number again, 772-226-4846. The nurse who answers the call will discuss the individual's symptoms, travel history, and potential contact with others who may have been diagnosed with COVID-19. If patients meet the criteria, They will be given an appointment at our drive-through testing location at Cleveland Clinic Indian River Hospital on the campus, starting today, Friday, March 20th. Our objective is to identify the individuals in the community most at risk and to ensure they are able to receive testing by following the Florida Department of Health and the Center for Disease Control criteria. By adhering to the guidelines, it will allow us to be judicious in our utilization of resources, which are monitored daily to ensure we are able to test those who are most in need. The phone triage process should help us to do that efficiently and effectively. It is also an effective way to keep individuals who may have signs and symptoms of COVID-19 separated from our other patients and from the community. To reiterate, patients will need to be screened by phone to determine whether they meet the Florida Department of Health and CDC criteria for COVID-19 testing. If deemed appropriate, they will be provided an appointment through our drive-through location. The number again, 772-226-4846. It can also be found on our website. Thank you.
Thank you, Dr. Peter. Just some final comments from Cleveland Clinic Indian River Hospital. We're grateful and proud of our caregivers who are doing a phenomenal job managing this demanding and unprecedented situation. We will continue to do everything we can to keep our patients, caregivers, and community safe. We are here for the community and all of our patients. Please stay home for us. Thank you. And I'd like to introduce Aaron Grawl, the state representative, for some comments.
Thank you, Doctor, and thank you for everyone for being here today. I'd like to reiterate Commissioner Adams' comments about how stressful this time is and how many answers we do not have at this time and all of the unknowns. And we understand that increases stress for our community, it increases stress in our families and our businesses. And so to that end, the state legislators throughout the state representatives, the state senators, we just finished our 60-day session, and we are hearing from all of our communities about those concerns and are doing our best to place people in touch with the best resources, the state resources that exist to deal with some of these additional stresses. Yesterday, the Florida House and Senate approved a budget with over $60 million dedicated to COVID-19 funding. We also will continue to share resources from other state agencies. A few of note, due to the increase of questions that we've received in these areas, are reemployment assistance questions. The Florida Department of Economic Opportunity is assisting with this program, and some people that may be eligible for reemployment assistance include those who are quarantined by a medical professional or government agency, those who are laid off or sent home without pay for an extended period by their employer due to COVID-19 concerns, or those who are caring for an immediate family member who is diagnosed with COVID-19. Also available pursuant to Governor Ron DeSantis, he activated the Florida Small Business Emergency Bridge Loan Program to support small businesses at this time that are impacted by COVID-19. The Bridge Loan Program, managed by the Florida Department of Economic Opportunity, will provide short-term, interest-free loans to small businesses that experience economic injury from COVID-19. The application period began on March 17th, 2020 and will currently run through May 8th, 2020. A number of other issues that we have seen crop up have to do with consumers and how individuals are being treated right now by different businesses. So there are price gouging hotlines that have been made available at myfloridalegal.com, and through the Attorney General's office you can also make those complaints. For any school closure updates or information regarding the end of the school year, the Florida Department of Education is obviously a resource, as is the local school district here in Indian River County. If there's anything that our office can do to assist any individuals in this community that are having a difficult time getting a response from a state agency or interacting with a state agency which could provide help, I would encourage you to call our office at 772-778-5005. And we want to thank all of you for doing what you can to prevent the spread of this pandemic. And it is imperative that we heed the advice of our public health officials at this time, and anything that we can do as a community to come together in a distanced way to make a difference in the spread of this pandemic is critical to our overall health. Thank you. At this time, I would like to introduce County Administrator Jason Brown.
Thank you, Representative Curl. Good afternoon. My name is Jason Brown, County Administrator for Indian River County. First, I'd like to echo Commissioner Adams' comments from before. I also want to assure everyone that our number one priority is the health and safety of all of our residents and visitors of Indian River County. County staff has continued to meet to determine the best steps to take in order to prevent the spread of this virus in many areas. In furtherance of our mission to keep everyone in our county healthy and safe, we have restricted access or completely closed county facilities, including our county administration building, which is now closed for in-person customer service activities in order to limit staff and customer interaction. Additionally, the county shooting range and Sand Ridge Golf Course will be closing at the end of business today and will remain closed until further notice. However, you can still utilize many county services such as downloading ebooks from our county libraries, paying utility bills online through the drive-thru, or taking advantage of online permitting services. For information on building and development services as well as other county services, please see the county website at ircgov.com. We remain in constant contact with the Indian River County Health Department and will continue to ensure our residents have access to the most accurate and up-to-date information related to COVID-19. Our Emergency Information Center is currently open and will continue to be open 7 days a week from 8 a.m. till 5 p.m. This information hotline is staffed by county employees who are available to answer your questions related to prevention measures, available healthcare facilities, travel guidance, and more. You can reach the EIC by calling 772-226-4000. We will also activate the County Emergency Operations Center tomorrow morning at 8 a.m. This will be a level 2 activation, and we will promote telephonic participation in order to limit the number of staff congregated in this facility at one time. As always, we will continue updating the county website, ircgov.com, with all new developments related to COVID-19. You can also receive updates by following us on Facebook at Indian River County and Twitter at ircgov. Remember, Indian River County is here for you, and we will continue to do all we can to ensure not only that our residents remain healthy and safe, but that everyone is informed with the most up-to-date and accurate information. And at this time, I'm asking everyone to please do your part to stop the spread of COVID-19 and flatten the curve. Thank you.
So at this point, we'd like to be able to take questions that you may have for the different individuals that are here and have spoken. Yes.
Do you understand the testing process here? I see your photos to test blood and How is the testing being done?
So I can tell you that the number of 22 relates to the individuals that were tested through your mental health laboratories. And that time period is approximately about 48 to 72 hours from my understanding. But I would refer your other piece of your question to the hospital in terms of the commercial lab testing.
So we do have testing, and our testing is being done through the Department of Health at times, but at this point mostly through commercial labs. Our turnaround time appears to be about 3 to 5 days to get those results. We currently have sent a total of 45 tests. 30 of those are pending and 15 have returned. I actually don't know the number of tests.
online, I can share those that information with you.
Other questions? Yes, sir.
Do you know where the man traveled to internationally for the case involving the 69-year-old?
Currently, that case is still under investigation. I can get that information for you if you can leave me your contact information. I can Yes.
Just wanted to know, how long do you think this is going to last, this virus pandemic? How long do you think that this will last?
So we are currently watching to see what's going to happen with this virus. I don't have a timeline to give you at this point. Certainly, every action that the public takes for those social distancing measures will help minimize the spread of infection within our county and lessen the individuals that get sick.
Thank you. I have a question for you as well, Mrs. Hawker. So we've been seeing, at least initially, as all of this is developing, there is, at least in the early stages of reporting testing numbers, a discrepancy between what the Florida Department of Health is reporting versus what private sector, hospitals are reporting. How can we get the most accurate information as quickly as possible about how many people have been tested, how many of those results are pending, and how many results are negative or positive?
So that information is posted on the Department of Health's COVID-19 webpage, and as well as indicates the testing from the commercial labs, the people that are under investigation that have been tested through the Bureau of Public Health labs. All of that information is updated on the state website between 11 and 6, twice a day.
And then just a follow-up regarding the 77-year-old woman. Is there an update on her health as far as how she's progressing?
What I can tell you is both of the cases that I discussed today are self-isolating and are recovering now.
Okay, sorry. I just want to know your thoughts. Do you think that at some point there's going to be a statewide lockdown or even a national lockdown because of all this?
So that information will be coming from the governor's office.
In terms of any action with that, I would not be
Initiating that locally, and perhaps Representative Rawl could touch on that issue.
We don't have any reason to believe that that type of lockdown would happen right now. Obviously, we haven't been given that information at the representative level. However, I think that what's important is as long as people continue to follow the advice of healthcare professionals, do their best to social distance, isolate when they can, there's less likelihood that the pandemic grows, and we are able to continue on the basis that we're working on right now. So, but that would be left up to the governor's office, and I assume that he would have a number of different inputs from our local health officials and state and federal health officials on whether or not that's truly in the best interest of our community.
Are there any other questions? Yes.
6,000 cases. What facilities were those people, were the swabs actually taken, those two patients?
I can tell you that one of those cases was tested at the health department and the other was tested at Cleveland Clinic and New River Hospital.
Okay. And are you releasing what parts of the county those folks live in?
No, we are not releasing that at this time. And what is important really for people to focus on, as you've heard echoed through each person that's here today, is those social distancing recommendations. We want people to be limiting their social interactions. We want people to be staying home and minimizing their interactions with others. And that really is the important message, as well as wash your hands, wash your hands, wash your hands, and certainly using hand sanitizer when that's not available. But those prevention measures are especially important rather than focusing on certain locations. applications of individuals which are not being released to them.
Thank you. Again, do you have a figure of how many tests have been ordered to come within county lines? I know you said earlier that testing is currently limited as far as the total collection of tests. Do we have a figure on that?
I can get that information for you. I don't have that right here at this moment. What I can tell you is testing is becoming increasingly available. I am delighted with the steps the hospital is taking to make that resource available in our community. And certainly the health department still has limited testing capability, but we are able to fulfill that role for patients that are referred by the physicians.
Can you talk about the number of people that are
I don't have that information readily available. I can tell you that there are 520 confirmed cases of COVID-19 in the state of Florida. 474 of those are Florida residents, and 46 are non-Florida residents. Thank you so much for coming. The service that all of you provide is especially important because you give us an ability to get this information out to the public. And yes, you have one more question?
I'm sorry, I just had one last question.
I'm sorry.
I'm not sure if anyone here has the answer to this, but has the National Guard been set up here?
The National Guard is not set up in New York County. Thank you all.